Hello and welcome. I'm your host, Neil Howard. Thank you for joining us for another segment of Health Professional Radio. In this segment, we're going to be talking with Dr. John Laird. He's joining us here from Medtronic to talk about peripheral artery disease, or PAD. He's going to explain some of the risk factors, signs, symptoms, management, and, of course, some treatment options. Welcome to Health Professional Radio. Dr. Laird, thank you for joining us this evening.
Well, thank you very much for having me, Neil. It's a great privilege to be here with you to talk about peripheral artery disease, which has been a big focus of mine in my 30-plus years of clinical practice as a cardiovascular specialist, and now in my second career as Chief Medical Officer for Medtronic Peripheral Vascular Health, where we develop many products to help patients with peripheral artery disease.
Well, what are some of the common risk factors associated with PAD, and how can people understand and maybe assess their risk?
Well, there are two really big risk factors for peripheral artery disease. One is smoking. This is another gift to us from the tobacco companies. The other is diabetes, and diabetics often suffer greatly from peripheral artery disease and are at increased risk for amputations because of that. Other risk factors, perhaps somewhat less important, are high cholesterol, sedentary lifestyle, hypertension, and obesity, and some of the typical genetic risk that's associated with increasing atherosclerosis.
So exactly what is peripheral artery disease, and how does it differ from other conditions of the same nature?
Yeah, it's a great question, Neil. Peripheral artery disease refers to plaque buildup leading to blockages in the arteries of the lower extremities. And this can result in reductions in blood flow to the lower extremities, and because of that, debilitating symptoms of pain when patients try to walk or perform activities of life. And in its most advanced stages, peripheral artery disease can lead to amputation of the lower extremities. This is a particular risk, as mentioned, for diabetics who often have an insidious form of peripheral artery disease with extensive blockages in the arteries of the lower extremities from the knee down.
You mentioned pain as one of the signs and symptoms of PAD. Are there other signs that someone should be on the lookout for? And is this often misdiagnosed as some other type of condition just based on some of the symptoms?
Yeah, because of the low awareness of peripheral artery disease in the community, symptoms are often confused or misunderstood by patients. The most common symptom, the medical term for it, is claudication. It's cramping or discomfort in the legs when individuals walk, because as they walk and they're using their muscles, they're unable to deliver enough blood and oxygen to the muscles to keep them happy. And so there's a cramping or a burning or pain that develops when people walk. In more advanced stages of peripheral artery disease, patients can have pain in their feet or in their toes all of the time, or particularly at nighttime. And they can sometimes develop sores or ulcers on the feet or the toes that don't heal because of the lack of blood flow. And in the very most advanced stages of the disease, it can develop gangrene or blackish discoloration of the toes, which often requires amputation.
Once it gets to that point, there's been no care, no treatment whatsoever, or is it common for treatments just not to work?
Well, peripheral artery disease is very common in the first place. Probably over 12 million patients in the U.S. suffer from peripheral artery disease. And as mentioned already, it often goes undiagnosed due to lack of awareness by patients and also by physicians. And so that many patients present in the very late stages of the disease where treatment is sometimes more difficult or complicated. But there are many things that can be done to help patients with peripheral artery disease, both from a medication standpoint, also with endovascular or minimally invasive therapies to open up the blocked arteries to the legs. And sometimes surgery can be performed, what we call bypass surgery, to reroute blood flow to the lower legs and the feet to improve symptoms and help avoid amputation.
Well, you mentioned smoking and diabetes as two groups of people affected by PAD. What role do systemic health disparities play when it comes to PAD, and how many people may be affected and be unaware that they have PAD?
Yeah, thanks. Those are great questions. It's been estimated that as many as 50% of patients with peripheral artery disease don't even recognize that they have peripheral artery disease, which is, I think, critically important as we talk about improving the care for these patients. And there are important health disparities which play a significant role in peripheral artery disease. In particular, African Americans are impacted about 4 times as often with peripheral artery disease. They have some of the important significant and insignificant risk factors for peripheral artery disease in disproportion, including hypertension, including diabetes, and including kidney disease. And they're oftentimes not offered beneficial procedures to treat peripheral artery disease as frequently as white or Caucasian patients.
Being Peripheral Artery Disease Awareness Month, what are some resources that are available for patients who may be affected by PAD or suspect that someone that they care for may be affected by PAD?
Yeah, that's a great question. There is a lot of good information about peripheral artery disease online. We at Medtronic have our own site, and patients are very welcome to search this and to take a look at the offerings of information, which I think are incredibly helpful and comprehensive. So they can visit medtronic.com/PAD to learn more about peripheral artery disease and some of the evaluations that can be performed by physicians to help diagnose PAD and also determine the severity of PAD. I think as patients visit their doctors, they should, one, be sure to take their socks and shoes off so physicians can evaluate the pulses in their feet to assess circulation. But there's a number of very simple screening tests that can be performed, such as the ankle brachial index, where you put a blood pressure cuff on the lower legs and measure the blood pressure in the legs and feet and compare that with the arm blood pressure. Normally they should be about the same, but in patients with peripheral artery disease, the blood pressure in the legs will actually be lower, and that can be a very accurate way of diagnosing peripheral artery disease. And there are other simple tests that can be performed, such as ultrasound studies of the legs to actually see the blockages and assess their severity.
What are some of the go-to treatment options once a proper diagnosis has been made?
Well, lifestyle changes are critically important, so we very strongly encourage our patients to stop smoking. If they're diabetics, we very strongly encourage them and work with them to try and get their diabetes under better control. Aspirin, just a baby aspirin a day, is helpful to reduce the risk of blood clot formation in the arteries and to reduce the risk of stroke or heart attack in these patients. Statin medications to lower cholesterol also are very beneficial and reduce the risk for progression of peripheral artery disease, as well as reduce the risk of heart attack and stroke for these patients. But for many patients, some medical therapy and lifestyle modification is not enough, and that's where we offer them endovascular procedures to try and open up or unclog the arteries. Procedures such as balloon angioplasty, stenting, or atherectomy, where we actually go in and remove some of the plaque from the arteries. And then drug-coated balloon angioplasty, where we open up the artery with a balloon that then delivers a medication into the wall of the artery to help prevent the artery from clogging up down the line. So patients should talk with their doctors about these procedures, what might be right for them, and what the potential risks of these procedures could be. But I have to say, as someone who's treated patients with peripheral artery disease during my career, these can be some of the most gratifying procedures that we perform, because of the fact that patients' quality of life can be so dramatically improved after these procedures. And also we can reduce the risk of amputation for these patients when they have very advanced peripheral artery disease.
You mentioned Medtronic's website when I was inquiring about resources. Could you give our listeners that website one more time?
Yes, thank you very much, Neil. So that website is medtronic.com/PAD, and there'll be resources about the risk factors for peripheral artery disease, treatment options, screening tests, and things that can be done to further evaluate these patients for peripheral artery disease.
Thank you so much for joining us here on Health Professional Radio. It's been a pleasure speaking with you.
Thank you very much, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. John Laird. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.